Welcome back. In just about a week, a federal policy that's kept almost 1 million Floridians from being removed from the state's Medicaid program will expire. And as that deadline looms, there have been many questions about what will happen next for those left without any insurance on March 31st. To find out more, ABC Action News in-depth reporter Rochelle Aline and photojournalist Josh Whitston spoke with local health experts.
The folks at Tampa Family Health Centers know what it means to fill a gap.
Tampa Family Health Centers are federally qualified health care centers. We are your community's health care center.
They're a one-stop shop that provides medical access to the uninsured, underinsured, and publicly insured.
We see everybody regardless of your ability to pay. We turn no one away.
And right now, they're working extra hard to make sure that last group continues to have access to insurance if possible. This comes as the state of Florida prepares to reevaluate its Medicaid policies and remove people who no longer qualify. The state hasn't been allowed to do this for almost 3 years because of federal pandemic guidance, but those protections expire March 31st.
We need to make sure that the patients are still getting what they need in the midst of life happening, because when life gets tough, the first thing that goes on the back burner is health care.
According to the State Agency for Healthcare Administration, or AHCA, about 900,000 people in our state no longer qualify for Medicaid. And leaders with Tampa Family Health Center say they care for about 3,500 of those people.
So what we're really looking to do is, when we're going through this redetermination period, is have the patients come in, have the community come in. You don't even have to be a patient of Tampa Family. Come on in. You'll sit down with our financial counselors. We'll see if you qualify for a different plan. And we also know we want to get you on that Hillsborough County health care plan if you can.
But outside of Hillsborough County, not everyone will be as lucky.
Allison Yeager, A-L-I-S-O-N.
Leaders with the Florida Health Justice Project say there are many people living in areas where a county health care plan doesn't exist.
We will have a lot of people who, as a result of losing Medicaid, end up in what we call the coverage gap. Those are people who earn too much to qualify for Medicaid, but too little to qualify for a marketplace subsidy. And those people are ending up without health coverage.
But there are still places you can go if you do fall into that group.
Places like federally qualified health centers, the public clinics that we think about in our communities that are providing care on a sliding scale. Or to their local public hospital, or to their local charity care hospital.
And in the end, they add that the possible loss of coverage for some is an issue we should all be concerned about.
There's really not just individual health. There's no such thing as individual health alone. There is all of us as part of communities.
Now, the process for this, the timing for this process is a bit tricky. AHCA says they will start on April 1st, and they add that the first policy cancellations could start as soon as May 1st. They also add that they won't be removing people all at once, but rather on a monthly basis over the course of the next year. And DCF says kids that are removed from the Medicaid program will be recommended for Florida Healthy Kids, which offers low-cost health and dental plans in the state. For more information on this reevaluation timeline and how you can get in contact with AHCA or DCF if you have questions, head to abcactionnews.com. In the studio, I'm Rochelle Aline.